Hey, Dr. Kurt here, and I want to provide kind of just a functional medicine perspective on spectrum disorders. So you've seen it more and more. Look in the grocery store, the Walmarts, the schools. You're going to see kids with autism. You're going to see them with sensory processing. You're going to see them with OCD. You're going to hear of more and more of PANS and PANDAS. And you name it, ADD, ADHD, chronic ear infections, whatever it is. And so what I always get asked is like, what causes this? And when you ask Facebook, guess what? Some responses are going to be like, oh, it's genetic. Some is going to be it's environmental. Some say it's going to be vaccines. And I'll be honest, like I don't think the vaccines cause it. There can be a contributing factor, but I think there's more to the story than a direct cause effect, especially when it comes to chronic illness involving neurological tissue, immune system issue, and kind of like just development of kids. We're like this amazing organism that's always adapting to give the best fighting chance. And I think at some point there's just an overload. And so my perspective in kind of 14 years of practice is a story I commonly see when a parent brings me a kid like, hey, they're on some sort of spectrum disorder, like what can we do about it? And one of the first things I want to do is look at the context so we know what we're up against. And so a common story I see is that there was a tough pregnancy, whether it was relational stress, whether it was unknowns on ultrasound that kept mom on high alert, whether it was food sensitivities, whether it was medication, a bunch of different aspects that shift mom into a protective mode when she's pregnant. So now when it comes to labor and delivery, she is like already on massive alert. And animals in nature, when they sense danger during labor and delivery, they're going to shut down labor and delivery. And we're no different. We're just animals. We're domesticated ones. And so mom gets to hospital and doesn't feel relaxed, doesn't feel secure, doesn't feel safe. And so labor starts to not progress as what the hospital would like it to. And so they need to speed it up. They would like to speed it up. And so here comes some Pitocin. We're going to give you some super hard contractions. We'll get the baby out faster, but it's probably going to make mom feel horrible. It's going to be super painful at the same time of just ridiculously strong contractions for baby. So what happens is because mom's in pain, let's get an epidural, get her on her back, but now baby goes into distress mode because these contractions are ridiculously intense. And so now because of the baby distress, heartbeats dropping, whatever it is, we need to intervene. And that could be a C-section. And it's not as easy as just unzipping the belly and pulling out. You got to think this uterus is contracting this baby and trying to getting out one way, where now the doctor and nurse are pulling the total opposite direction out of the belly. And so there can be some trauma there. There can be some physical aspects there that are now creating a death by 1,000 cuts. And not a death, but like a spectrum by 1,000 cuts. Or maybe it's not a C-section, but they used vacuum, or they used forceps or suction or whatever it is. Those are all things that are going to add more stress and put that baby more towards a protective mechanism than what its natural anabolic recovery, eat, sleep, poop mentality. And so baby's on super alert, nervous system's on super alert. We get into the real world environment, and within minutes, within seconds, here's a jab with a hepatitis B needle, here's a jab with a vitamin K needle, here's some ointment to put in your eye for antibiotics. So we're disrupting the microbiome, or the biome in general, like regardless of in the gut yet. We're now shifting the immune system into alert, and we're overloading a vitamin that, again, like maybe too much too soon at that point. So we have mom stressed out, mom fatigued. She's laying on her back, like just trying to recover from this hard delivery. Baby's pissed off, and guess what? They're not going to connect as well. So baby doesn't start nursing as they need to, and we start introducing foods, formulas, which could be dairy-based, it could be corn-based, it could be soy-based, it could be sugar-based. And when you look around, what are all the food allergies we're seeing with kids these days? Dairy, corn, soy, wheat, like all these first foods, and it's not by accident. And we want to blame it on leaky gut. But what I would argue is that we were born with a leaky gut. Like intelligently, we were born with a leaky gut. So when mom does breastfeed us, her antibodies pass through this gut barrier into the bloodstream to provide an immune response that the baby can't do yet. And as the baby starts to develop, as they start to mature, that gut barrier gets stronger and they start developing their own immune responses. So we have stressful pregnancy, like amazingly difficult labor and delivery. We have foods too early. We have a lot of medical intervention. And then fast forward 18 months, 24 months, where we can have 36 doses of vaccines in those first 2 years of life. And then potentially then we have a regression at that point. But it's not that caused it. It's a series of events that will disrupt neuroendocrine aspects, so the brain's communication to the body. It's going to affect the gut and GI system, and it's going to affect the liver and detox systems. And so it's just this accumulation of a bunch of little hits that finally mount to this expression of a large regression of something, whether it could be ADD, OCD, PANS, PANDAS, autism spectrum, whatever, sensory processing, you name it. It's just all different levels of some of the similar dysfunctions. Now, if your story is totally different than you, then yeah, like there's a different story to that. But more often than not, I've seen something similar to what I just described from not poor pregnancy, but like stressful pregnancy, hard labor and delivery, not nursing very well, lots of medical intervention, and then boom, we have this falling off point. And so don't be quick to blame a disease on a single item. Not everyone that smokes gets lung cancer. Like, not everyone that gets in a car accident dies. Like, there's lots of variables within your person's expression. And so when in a functional medicine aspect, we have to look at the context, we have to look at the history to give us all these clues in order to figure out, okay, how do we support you or support your child or support whoever's looking to get help. So hopefully that makes some sense. Again, don't be too quick to judge it was this, A causes B, because it's rarely the case. So think about it. If it makes sense, it does. If you think I'm an idiot, well, there's that too. So I will talk to you later.